Hello, I am Andrea Cooley, one of the owners of Des Moines Mom. Thank you for joining us today. We are talking with Dr. Boonstra with Blank Children's Hospital, and we have an important topic to talk about today, which is vaccinations and school and sport physicals for your kids. So I know with spring and summer sports getting started that lots of moms like myself are taking a look at our kids' kind of records and thinking, hey, it's time to schedule a physical. So what can you tell us about timing for sports physicals or school physicals and things that that we should kind of keep in mind?
Sure. When it comes to physicals, there's a lot of different things to think about. One is what grade they're going into, because there are really, depending on the school district, certain ages that you need an updated physical form for. It's good to get your annual physical every year, but it's not necessarily something that the school is going to ask every year. Definitely when you go into kindergarten, and I think certain other grades, or when you're changing buildings. So you kind of need to know what the rules are for your school.
Okay.
It also is important to know what your insurance says, because some insurances, they're okay with you getting your kid a physical every calendar year, whether that means that you got it in August and then you got it again in February, your child's next one in February, because let's say they had a January birthday. So, that is okay with some insurances. Some
Mhm.
insurances are very particular about we will not pay for your physical unless your child is a year and a day or something like that. So be mindful about that. And most clinics probably are trying to make sure, they're probably looking at that when they schedule you.
Mhm.
Hopefully, our clinic tends to err on the side of, let's just make sure everybody's been a full calendar year. That way we don't have to worry about anybody's insurance. But
Sure.
if you know that your insurance will do it anytime in the calendar year, that's fine.
Mhm.
So most of the time, if you need a physical for enrollment in the fall,
Mhm.
most schools are okay with accepting a physical that happened anytime within that last 160 or
Okay.
365 days. So if your child got their physical in, let's say they need a new physical for fall, but they got their physical in January or even in the end of the year before, that's usually okay. There might be some exceptions to that, but I think most schools understand that you don't necessarily get a physical more than once every
Sure.
365 days. Sports can have their own physicals that you need to do. A sports physical is essentially the same as a annual physical, but they want to have certain things documented specifically on the form.
Mhm.
So there might be a special form that the school or the sport has, or there's a standard Iowa, like a state uh, sports physical form that we print out and fill out for sports.
Okay. And I
So a
see
lot of things to keep in mind.
And I seem to remember just from scheduling my kids' physicals that it seems like the earlier you call to schedule those, the better, because sometimes
Yeah.
those kind of get booked out
Yep.
longer. Um, so
If your
even
child's due, you really do want to think about now. So you don't want to wait until the end of summer, because there's a lot of rush to get school and sports physicals in. So
right.
now's the time. If it's been a year since the last physical, get it done.
Yes, especially I think that just with the pandemic that if kids weren't sick, that maybe you thought,
Mhm.
well, we can push off a regular visit, but
Mhm.
it's important that kids are getting in regularly. So what can a parent expect, if they're healthy but they haven't been to the doctor's
Mhm.
office during the pandemic? What kind
Yeah,
of precautions or things should they be
sure.
aware of when they're making an appointment?
Mhm. So it's clinic dependent. In our
Mhm.
clinic, we are focusing our physicals in the morning, focusing our sick visits in the afternoon. So we try to keep that a relative barrier. We have to make exceptions sometimes
Sure.
based on situations, but that's one of the things that we're doing. And then all the personal protective equipment that we're using. So we require masks in the clinic. We wear our masks. We wear our face shields, and we are careful about what rooms we use if there's somebody
Sure.
who's been exposed or seems to have symptoms that are consistent with COVID. Really, a well-run clinic who's taking precautions, it's going to be a low risk situation to be
Sure.
able to go and see your doctor. And I really don't want, whether we're talking about pediatric visits or adult visits or whatnot, or dental visits or any of these health visits, I really don't want people to be putting those off because they're worried about COVID. Call and talk to
Sure.
that provider about what they do and how you can stay safest. But all of those visits are extremely important. And there's really no reason, except in the rarest of circumstances, why you would want to push that off. Early in the pandemic, when we didn't quite know how everything was going to go down, when we didn't know what precautions worked, what mitigation strategies we could put in, and we kind of had to see, there was a lot of that delay, even on the part of doctors. We were like, okay,
Mhm.
our less important visits, we're going to hold off. We're going to try to do some telemed or whatnot. But now that we are able to really see what works and what we don't need to do, what we do need to do, it's really very safe to go see your doctor for whatever you need to see your doctor for.
Great. That's good to hear. Just good to have that reassurance. Now kind of switching to talking about vaccines.
Mhm.
I know, when my kids were little, it seemed like, we were going to the doctor every couple months to get shots. And now I have an almost kindergartner. So I know she'll be getting kind of, a round of shots before she starts that. But then kind of once you've passed that first kind of chunk of vaccines, what are the next vaccines that are required for kids? Are there any in elementary school to junior high and high school that that parents need to be thinking about?
The you get your I'll do a really brief review of kind of that schedule. So you get vaccines at every couple of months as an infant through the
Mhm.
first year of life or so, and then it spaces out a little bit more in the second year of life. And then there's a little gap between the routine vaccines. You still get your flu shot every year. Then
Mhm.
you get a few vaccines at age usually between 4 or 5, right before
Sure.
kindergarten. Then, really, besides the annual flu shot that everybody should get, there's not routine vaccines until the child is about 11 years old, 11 or 12.
Okay.
That's usually the next set. And some of those are required for
Mhm.
seventh grade in Iowa. So those are the kids I tell them that, and then they kind of think, okay, well, I don't have to get shots again until this far. I'm like, oh, you do need to come in and get your flu shot in the fall. We'll need to get that done. Fortunately for some kids, there's the option for the mist, so they can just get the nasal spray
Mhm.
each year, which is really nice for some of my kids that are a little more nervous
Right.
about getting a shot every year. But most kids, surprisingly, when you get into that grade school age, especially if you have those good conversations with them, and that's one of the things I love to do with kids is talk to them about what they understand about what shots are and how
Mhm.
their body works. Start having those conversations. And I think that most kids, obviously, any child can be nervous about something that's going to hurt a little bit, but most kids
Mhm.
do really well. I'm always so impressed by how well kids handle shots if they're kind of prepped to do
Right.
so.
Right. Great. So aside from, just if you had a cold or some other sickness that
Mhm.
you're coming into the clinic for, kind of the main things to focus on would be kind of that annual flu vaccine, and then whether it's an annual or, as needed physical or
Mhm.
well exam. Is that
Yeah, that's pretty much what most kids need. Now, kids with asthma, kids with other chronic conditions where they take a regular medicine or they just need regular checks, those kids might come in more often, quarterly or every 6 months, something like that. So every kid's a little bit different, but the basics, yeah, are
Yes.
those. Yeah, your annual wellness exam, your annual flu shot, and then thinking about what shots are needed, like what other routine shots are coming up
Mhm.
in adolescence.
Great. And I feel like hopefully, I'm not having to take my kids to the doctor a lot during the year, but just as a mom, it's nice to kind of have that peace of mind to kind of check in, check out, how much they're growing, just some
Yeah.
of those other milestones with that annual visit.
Yeah, we do a lot with that. So there's definitely milestones. There's checking in about just things that are stressful for kids.
Mhm.
Sometimes there's things that kids don't bring up to their parents that they bring up to the doctor. Um, School stuff, stressful situations at school, those kinds of things. And then also you just be surprised how often you just pick up something that you
Sure.
wouldn't have. They weren't sick with it, but you hear, a heart murmur, you pick up something on exam, and that needs a little bit of workup. It's not super common,
Mhm.
but it's something that it's worth at least having
Right.
a pair of medical eyes to
Sure.
check in once in a while.
Great.
And there's a lot of other screening that we do to check on
Mhm.
as well.
Well, thank you so much, Dr. Boonstra, just for answering our questions about physicals and vaccines. And hopefully parents can, just kind of know how important it is to schedule those regular checkups. All right.
I think one of the things I want to bring up, if
Mhm.
you've got a minute, is
Yeah.
that just how important it is to, during the pandemic, we did see a deficit in terms of immunizations that were given nationally
Mhm.
and across the state. And again, this was pretty common and understandable in that early in the pandemic, there were a lot of people nervous, people would reschedule or push
Mhm.
off or cancel, but not reschedule. Some
Sure.
doctors' offices, we were trying to get in those like more time sensitive vaccines, but if it was a well child that we could vaccinate within a range, we might have uh, held that off for a bit until
Sure.
again we figured out what protocols we were going to do. Now we're at kind of a vaccine deficit, and it makes those of us who kind of watch this a little bit
Mhm.
nervous, and the potential to see outbreaks of things like measles or whooping cough once COVID is under control. We
Mhm.
don't want to see these things coming out down the road. And
Sure.
so we're still at kind of a vaccine deficit in terms of what should have been given over that year. And we're trying to catch up.
Okay.
Like we're down about, nationally speaking, about 1 million MMR vaccines, measles vaccines
Mhm.
uh, in this cohort. When normally over the year we give about 8 million in the United States. And so we're down about 1 million, like 20%
Oh, wow.
deficit. So that's got to come back up. Now, hopefully that'll all get caught up when people are starting
Mhm.
to go back to school and whatnot. But
Sure.
it's all the more reason why it's a good idea to check, make sure
Right.
that your child's not missing any vaccines,
Mhm.
and make sure that you're getting in for that physical earlier so that
Right.
you're
Get it
not caught in a
scheduled.
rush at the end.
Right. Yeah. No, I think that's a great reminder. So, well, thank you so much. We appreciate you taking the time to be with us.
Thank you.